Hi everyone, I'm covering Mexico, and the thing about Mexico is there's a lot of lessons about aging in a developing nation. They're in a very transitional state, and here's a summary of kind of what the country's going through. They tend to rank top in health outcomes across developing nations, but below most developed countries. So again, sort of signifying that they're somewhere in the middle. And though their GDP and their population growth is increasing quickly, a lot of the health infrastructure is not keeping up with that. So they'll need to continue to harness health infrastructure development and avoid falling further pitfall to common chronic conditions that plague developed nations, like diseases of the affluent that tend to come from having a sedentary lifestyle and not enough physical activity. Here's a population map. You'll see in the center, Mexico City is where most of the population is based, but we do still have a lot of rural areas up north. And here is a couple population structure graphs. At the top, you'll see Mexico in 2050 and Mexico in 2015. And in this first one, we see the very traditional symmetry happening with the most population at the bottom, and then as people age out and die, it's smaller at the top. In 2050, we're not going to see as much in the bottom, and we're going to see most clustering around the middle for working age. And then in America, we're already sort of having a weird structure where the most of our population is in the middle. That's only going to be exacerbated as projections have most clustering again in the working age in the middle. And these people are aging out into the top, but we're not having, we have a low fertility rate, so it's not supplementing those people coming into the working class at the bottom. So thus we have a higher dependency ratio with mostly caused by people at the top. And here's some demographics. Mexico has a population of just over 120 million, expected to grow by 30 million by 2050. 65 and up composes 7% of the population currently, expected to grow by 18% to 18%, where ours is at 15% currently and is going to grow to 22%, which that's a high proportion of our population, but it's a slower growth than Mexico. Their life expectancy at birth in 2015 is 76, but if you make it to 60, it grows to 82, conversely to ours, which is at 80 at birth, but only 4 years higher for life expectancy at 65. So if you make it to 65, you have a better chance of living longer. Same to Mexico's 60. Again, the age structure in Mexico, it's more concentrated in the bottom two brackets, 0 to 14, which is their designation for adolescence, and 15 to 64, whereas ours is a little bit more sparse and not quite as populated as much in those lower two brackets. Mexico's fertility rate is decreasing with their infant mortality rate. One, we would say, is a positive indicator of growth, the other, not so much. As far as demographics, the net migration rate is increasing in Mexico, which is a sign of development, but it is still a negative migration rate. There is still more people leaving than coming in. So though it's increasing towards zero, it's still negative. So hopefully as things continue to grow and develop in the country and their GDP and health infrastructure increase, we'll see that migration rate get closer and closer to breaking even at zero. They are considered an upper middle income country, so not quite upper income, but of the middle of the transitional developing nations, they are kind of at the top of those. We see that over and over again in Latin America. They rank at the top of most health outcome measures. They are a member of the G8 plus 5. They were included as an emerging economy. Of the older population, which they designate as 50 and over, half are under 60. So what that says is that is a younger, older population. And that will continue to expand out a little bit. By 2030, we'll have 28% of the population being over 50 and only 11% over 65. So it is expanding a little bit, but we do see their older population being clustered in the younger old, the 50s and the 60s. 79% live in urban areas like we saw in that heat map. 53% are female, so that means there's a slightly higher widowed rate than in the US for females, but it's actually lower for males. 56% have no formal education, which we'll talk about in a minute. That's beginning to change, but as of now, the older population in Mexico is not very educated. 61% are employed, and only 10% of 50 and up are retired. The top three chronic conditions: hypertension, diabetes, and edentism. The first two are seen as sort of developed nation woes. We see those as being caused by more of a sedentary lifestyle. So this will probably be continuing as Mexico expands their GDP and their health infrastructure. But of 70 and up, so of the older old, we see more of kind of the old world diseases, edentism and cataracts, also accompanied by hypertension, which just sort of comes with age. But I think we'll see these, especially edentism and cataracts, begin to decrease as Mexico installs more sort of preventive health measures into their health plans, which are very relatively new for the population. And they do have a high rates of overweight and obesity, and these have been increasing recently as their GDP increases. 15% of Mexicans have diabetes, which is well above the US and other OECD nations. And we'll see OECD a lot. That's the Organization for Economic Cooperation and Development. And it's mostly quote unquote developed nations, but they are including a few developing nations like Mexico because they're projected to have higher and higher GDPs in the coming years. The highest prevalence diseases are diabetes, hypertension, like we said, accompanied closely by arthritis, angina, and asthma for people over 50. They are doing a pretty good job at some preventive measures, some not so much. 50% of all ever smokers have quit. They still have high rates of heavy drinking, the highest among SAGE, which is the World Health Organization's study on global aging. We had that as required reading. It includes Russia, Asia, Ghana, South Africa, China, and India. And Mexico tends to rank very high for health outcomes among SAGE, but again, lower than most what we would call fully developed nations. 29% of rural Mexicans over 50 and 16% of urban residents get enough fruits and veggies, so that's not nearly enough. Similarly to physical activity, the rates are 66% in rural, which is decent, but only 59% in urban areas. Healthy life expectancy per the SAGE outcomes at birth is 67, and at age 60 is 76. So again, you're gaining about 10 healthy life years if you make it past 60. Their public health infrastructure has been increasing over the past few years, but it's still not where it probably needs to be as they continue to grow with their GDP. Their health system, that should be health, not healthy, is really a sort of fragmented state-by-state infrastructure, where each state has different systems of care and different payment structures, which can be not only confusing but difficult to navigate, not unsimilar to the U.S. health system. We do have high administration and out-of-pocket costs in Mexico for access to healthcare, which, as we know, sort of contributes to inefficiency and lack of continuity. Seguro Popular is the public health care fund started in 2004, so it's relatively new, but it is really popular and covers about half of Mexicans. I'm going to skip this for time, but you can come back to it. It's about the disabilities and proportion of people that have difficulty with any movement or any mobility or ADLs, which we know are activities of daily living. And back to the health insurance, it is, like we said, very fragmented. It's split between their Social Security, private, public, and separate subsystems per each state. So most insurance in Mexico is tethered to employment, which contributes to lack of continuity across the system. It's also problematic for a growing, aging population that either might not have employment or might lose that when they leave their employment. There's not a high rate of pension coverage over those that are retired, so that's going to have to increase. Of SAGE countries, this is one that they rank lower in the outcome. In this, they're least likely to see a doctor in the last 12 months. Most patients use public clinics over hospitals. We do see that the hospitals are mostly clustered in the urban areas, so it can be difficult transportation-wise to get there. The average hospitalization rates are low because most people are using the public clinics, but they do increase with age. And overall, Mexican GDP percentage towards healthcare is 6.4%. I think we'll see that increasing as the infrastructure starts to increase. Um, there is an income gap in Mexico, not unlike the US, but because educational opportunities are expanding, especially for women, um, one of my papers, one of my peer-reviewed papers that I looked at suggests that we're not going to see this income gap widening. It actually is going to remain the same or potentially decrease because it is accompanied with these expanding opportunities in education. And a lot of developing nations aren't seeing such a high rate of education expanding, versus also the US, which already has a high um, overall education rate. We don't have much more room for expanding that because it's already pretty high. The disability prevalence and likelihood to transition into disability is higher. Um, I think this might be reversed. This is Professor Emerson's study. Sorry, I just had to fix this. Actually, disability rates are higher in the US than in Mexico, and this is one of Professor Emerson's studies. And they found that also Mexicans were less likely to transition, older Mexicans were less likely to transition into disability. And they were more likely to transit, US residents over 65 were more likely to transition into disability. But because of the fast pace of older population growth in Mexico, and less state infrastructural support for Mexicans with disability, we could see this eventually sort of flip-flop. It also could suggest that old Mexicans are more evolutionally sturdy group. Basically, they survived high infant and child mortality rates of their cohort, and thusly were more likely to sort of end up in this old group. And also, a cultural implication could be that Mexicans are more likely to underreport disability. This is a chart from that study I talked about that was looking at education rates. As you'll see here in the 70s and the 80s, current 65 and over populations are almost 100% likely to not have any education past primary school, whereas in 2050, we'll see this white sort of bar graph take over, where this is secondary education. So people in their 70s and 80s in 2050 will be much more likely to have had education, and hopefully that will positively impact health insurance rates, pension rates, and just overall positive impacts on the healthcare infrastructure. As far as long-term care, it's pretty much lacking. You can pause the slide and look into it a little bit more in depth if you'd like. But basically, the only reason it's starting to increase is because foreigners are coming in and want to retire in Mexico. There is a lacking of overall support networks. Basically, the few organizations that do have the infrastructure for the aging population in Mexico in mind give out cash, similar to Social Security insurance here, but it's basically trying to reduce poverty rates in hopes to alleviate aging issues, which we've seen over and over again in our reading is suggested as the best way to help with aging issues is to eliminate poverty rates. And as far as end-of-life care, it's pretty much lacking as well. Palliative care is included in the Mexican health law, but it's not really enforced based on several reasons, including high cost for morphine. But it's beginning to get a little bit better, just like it has in the US, but it's taken a lot of time. And again, there's a lot of fragmentation between states. And you can look into some of these sources again if you're interested. And as far as values for Mexico, it's highly Catholic, which was influenced by the Spanish conquest. There's an importance on family connectedness, which has an impact on later life decision making and end-of-life support systems. It's basically all coming from the family. And Dia de los Muertos is also a very big cultural influence and impacts how the country deals with death overall. Here's a couple slides from Dia de los Muertos celebrations. This was in Mexico City. You can see how popular it is. We know about the traditional dress for it, and it's also a merging of sort of Roman Catholic and Aztec ideals. And here are my references. And again, please go back on some of the slides and pause and look through those statistics if you're interested. Thanks much. Bye.